This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm T.G. Lafredo, and this week on the program, we're talking about OneCare. OneCare is the new patient portal and electronic medical system, record system, that all of KRMC is going to fall under. My guest is Dr. William Gustin. And hey, Doc, welcome.
Thank you. I'm glad to be here.
There's a big change that's coming up here at KRMC.
Indeed.
And you're part of making sense of that for us.
Yeah, I actually have worked for the electronic health record named Meditech. That's the system, and the version is called Expanse. It's a web-based platform. And Kingman's been at this for almost 2 years now, working through developing the new platform and delivering it to all the venues of care, from the electronic health record in the ambulatory setting to the emergency department to the hospital itself. So a lot of the patients will be seeing some new screens popping up June 1st, and the doctors will be going through a big change.
And you are a hospitalist.
Yes.
You've worked in medicine for plenty of years. You are not technically or not currently a KRMC employee. You've been visiting and helping make sense of this, but you're going to be joining us as well.
That's correct. Yeah, that was the original plan. I was going to swing by here in October and become an employee and maybe help work with the system a little bit, because obviously I have experience with it. But as it turns out, I became a consultant here to help deliver the platform, help develop the messaging, and just all of the details that go into bring one of these large implementations together. But I'm still on the docket. I am waiting for my Arizona license, Arizona Licensing Board. I'm ready whenever you want to send it to me.
It can take a while.
Yeah, it's all right. But as soon as I'm licensed in Arizona, I will be joining the medical staff.
Yeah. And we'll look forward to welcoming you
Thank
then.
you.
Maybe we'll have you back for another conversation. There are plenty of changes that hospitals make that may or may not affect patients, but patients don't necessarily need to care about or take note of. When a hospital changes its electronic medical records, it is a big undertaking,
Indeed.
And patients do need to be aware of it. Why?
Well, and I'm glad we're having this conversation today, too. I think reaching out to the community for just an understanding of how big this is. Implementations of software, you would think it's just software, but every workflow, every aspect of medicine and the delivery of care at Kingman Regional is going to be touched by this new electronic health record. We commonly say it's not a software implementation, it is a hospital implementation. Imagine all the walls are staying the same, but all the wiring is going to change. And all those people who access the information, they have to learn a new system. So the patients are along for that ride. I think you'll recognize as a patient, starting in June, that they may ask you a few of the questions over again to train the system, train your dragon, train your system, and get comfortable with this one record across all venues of care. So it's a big deal, and I don't take it lightly. It's been a great consulting job out here. But to have it all come to fruition in June is going to be really, really great.
I do want to get into some of the specifics that patients and doctors, for that matter, can expect when we make the change. But I'd like to talk a little bit about the background, the set of problems and challenges that comes with implementing a new medical record system. This is a modern problem. This is something new for us. I'm thinking back on the days when all of the doctors' records were handwritten. Indulge me a bit in this. When did electronic records really come to exist?
It's a good question. It's been an iterative process, an accelerating process over probably the past 2 decades. All of us look back on the days of paper fondly. Paper's great. Paper's powerful stuff. The chart was you and your patient, like that. You just had that patient-doctor relationship. Data started flowing. There's some laboratory results, some radiology results. Those were even few decades ago when that first started, but that was only read-only. That was delivering. Really in the past, probably I'll say from 2000 forward, maybe even a little before that, there was this transition of, okay, how much can we bring to the computer and have it be displayed? And I think the patients probably recognize when computers first started entering into the ambulatory areas or the hospitals, it's been a while. And then there's this acceleration that happened where, okay, but now I want to be able to order in the system, and the physicians should, or all providers should document in the system. That's a whole other level of complexity. And for healthcare in general, that was a big change. Paper started becoming secondary. And we've been living in a hybrid paradigm for probably 2 generations, really, at least a generation and a half, we're finally moving into that paradigm where it's almost all web or computer based, and the paper is finally taking a back seat. Again, a lot of us miss the paper. I loved paper too.
I thought maybe you were being facetious when you said that initially.
Paper's great. It's me. It's a note. I just want to write a note. I think for a lot of doctors, especially generationally, it's been a big change, and some people are finishing their careers now saying, "Whew, I finished with paper, yay!" But that we leave a lot on the table that computer systems can now accomplish. The web, the internet, where I can reach out to patients, I can share information between my primary care provider and my hospital doctor or my specialist. Paper was always faxed around, but it was slow. It was heavy lifting all the time after that. Where as you teach the system, and the smarter that OneCare gets, that OneCare is our project. That is the implementation. It's called OneCare. As OneCare gets smarter, the patient should experience that acceleration where all the providers are collaborating together. And that's just not something we could really ever do with paper well. Paper and phone calls, always important. I can't say they'll ever go away for sure. But now we have new tools to really accelerate care and give a better experience and better outcome.
Not long ago, my wife, let's say it was a few years back, she handed me a medical journal that had arrived at the house, and she said, "Check out this article. I think it will interest you." There are a lot of things in medical journals that I can't read anyway because they're way over my head. But this was just a short personal essay by a doctor, an older gentleman, who was talking about, he was lamenting the loss of the handwritten note. And he was saying that in the hospital where he worked, the technology they were using required essentially that when he would see a patient, it was multiple choice. Was it, what happened during this visit? Was it this, or this? And he found it very frustrating because there were a lot of visits and there were a lot of circumstances that didn't fit those tight formulae that the system required. Now, I know from chatting with you a little bit that you come to Meditech because on the one hand, you're a doctor and a practitioner. On the other, you have a mind for systems. You like analytics. So I'm wondering, thinking about this doctor and his essay about how he misses paper, how do you make a system, or how do you help to feed a system that really does capture the experience that a doctor has with a patient? How can you document all those finer points?
No, it's a very good question. There's probably a whole hour about the culture of the electronic health record. How has that come to fruition? And for a lot of the doctors, especially electronic health record 1 or 2 generations ago, it was very data-driven kind of points. We've all had the surveys we've taken where it's just page after page of tapping this and clicking that, or fill in the blank. And that's where a lot of electronic health records started. What's so encouraging these days is, with Expanse in particular, the opportunity to have actionable steps. So if I do this, 4 other things happen in the background, and I can write a note again. It's not just click, click, click. I can talk it in with voice recognition. Some of the patients on the radio show here may have seen their doctor pull up a microphone and start talking to their computer. One thing I love about this particular system is it's touchable, it's mobile. You might experience one of your providers is going to be on a tablet, or they might even hand you a tablet and be able to share information with you. It's a whole new paradigm, and I keep using paradigm a lot, but I think it's fair. But it's a whole new approach to healthcare. I think for a lot of the providers, coming off paper, even all of us have baggage. We've had electronic health records for a while. We've had experiences, and it's like, wow, it's just I have to drive the system so hard to make it work. I think with Expanse, I'm not an archaeologist. I don't like to dig. I want the computer to do the work for me. And with this system, it really at least begins to do that, so that I can have this partner in my pocket and have all the benefits of being on a web-based system, and also get a little taste of, it's my note, I just want to write a note, I just want to drop some orders, and it works for me. So I think there's a give and take with moving any industry to a computer system, but obviously there are some benefits that if we get this right and really nail it down over the next few months, and there'll be optimization, I'm sure, that we can develop a really high quality, genuine experience for both the providers and for the patients who see them.
Over the last several years, there have been multiple platforms in place here at KRMC.
Very common.
Where is it? You see that everywhere you go. Yeah. So the ambulatory medicine, or just your general practitioners, they were using one system. The inpatient setting used a different system. The emergency department had a third system. You get the point. And so if you had a patient come in at 3:00 in the morning for an ER visit, that information might not have been available when he went to a follow-up the next couple of days later, or it might have been buried somewhere, as you say, archaeology. And this is one of the major advantages of the new system, right?
Absolutely, it's one system. It's even weird for the providers, and I would even offer the kind of, if you take a step back and say, well, if I was a healthcare provider, almost anyone in the system, imagine working in a partial paper, partial computer experience, but then you have 3 or 4 different platforms. You have to sign in, sign out. Is that the correct source of information? Is that the most recent? There's even calling out to health information exchanges and things. Is that the right stuff? Do you call the pharmacy? There's been disparate systems that make it very hard to know as a clinician, a provider of any sort, is this really the information that's right? And the patients may have experienced redundancy in asking questions. That was honestly kind of a workaround. We were trying to be safe. I think certainly safe patient care is number one, but there was a lot of heavy lifting to make that happen. One of the greatest benefits, joys I have working with clients nationally to help them get into a single system is the relief. And they don't buy it. They won't even buy it June 1st. It'll be, July or August. It's like, wait, I don't have to do that anymore. That's where you start recognizing the advantages of being on a single medical record. Medical record and health record we use interchangeably. Medical record is still probably a little more technical. It's the computer. It's the health record. It's the story of the patient. So I prefer to say electronic health record, but obviously we can make that interchangeable. It's the health story of a patient. As you were talking about those disparate systems, the opportunity to say, well, just as an example, one of the providers I was just talking to, I think even here at Kingman, yeah, but when I get my results back, how's the primary care doctor going to know? They just know, like it's part of the system. So, well, how do I actually make sure they've seen it? Well, it's going to be up on what's called a workload, and they'll have little to-do lists and things that'll click over to the doctor saying there's a new result for my patient. We're even working on some newer technologies over the next year or two where some of this may be provided over the mobile phone for the provider or pushed out on the portal for the patient. The opportunity to exchange information on one system is so much easier that it's almost cliche to say that this will be better. Of course it is, because you're only working with a single source of truth, and that's what the OneCare platform, that the overall Kingman strategy of OneCare is trying to deliver for our patients, the community to see what collaborative, coordinated care really looks like. So it'll be fun. I'm really looking forward to it.
It's time for a quick break on Focus on Your Health. We'll be back in a moment for more with Dr. William Gustin. Stick around. Support for the Arizona Community Radio Network is provided by Kingman Regional Medical Center. KRMC is pleased to recognize Dr. Justin Garrison and Physician Assistant Curtis Manley, winners of the Physician Assistant Partnership of the Year Award from the Arizona State Association of Physician Assistants. This award is presented to the doctor and PA collaborating to improve patient care. KRMC. Welcome back to Focus on Your Health. I'm T.G. Lafredo, and this week my guest is Dr. William Gustin. We're talking about OneCare, KRMC's new electronic health record. Change can be a gift when you're ready. Change can also scare the pants off of a lot of people.
Yeah.
And when you're consulting and going into these, clinics and these big hospitals, and you're saying, "Here, I'm bringing you a system," I can guarantee, I just am picturing some of the docs standing there with their arms folded saying, well, you know what? Some very smart people brought us a system before.
Yeah.
And how do you navigate it? Because it's like election promises, right? How do you win those hearts and minds?
Hopefully we're doing a better percentage
no, but
than that.
I get it. They've heard it, right?
Sure.
And some of them had the experience where it took a step back, not a step forward. No,
absolutely fair. I think from the beginning, we want it to be a provider-driven change, provider-driven implementation. So many of us, and not just in healthcare, I think any large industry, a lot of us in the middle management or even upper middle management started talking into the void. Like everything got big, everything got impersonal, and healthcare is no exception. We lost touch for several years about being a stakeholder in our own environment. These implementations, and we have the HIT value map that we always go through, sort of this Venn diagram, and I use the 3 Ps: people, process, and platform. The platform does what it does. It does it well. I really enjoy the platform. It's getting better all the time. But many times the people aren't necessarily ready. Change is always scary. And the process is in place to affect change and also to rework workflows. That takes work. That's why these implementations are 12, 16, 18 months long. The platform can be ready to go, but it's acculturating, is that a term? Working with the culture, working with the system to know what we're getting ourselves into. Entering into any new implementation with eyes open and hands ready to have handshakes and say that we're doing this with you, not at you or for you, is just a great win. And I think Kingman's been all about that.
The new electronic health record that is launching on June 1st, that is called OneCare, as we mentioned, and that will, a part of that, a little bit down the road, will be a patient portal, a new patient portal that's called My Health Connection. Mm-hmm. And probably the average listener is sitting here saying, okay, well, we've heard about the doctors and the institution. What does this have to do with me? So let's talk about that. What can patients expect with the changes coming up?
A couple good things. I think the portal, whatever portal experience they've had, I believe will be the same going across. There'll be some future developments too. Now that we'll have the clinical aspect of it right, the push out and that communication back and forth on the portal will be accelerated. And I think there's some really fascinating stuff coming over the next couple of years to make it a convenience for patients. A lot of us have had portals before. Certainly I'm a patient. I've had portals, and some are better than others. But it's sort of one way. I think our portal experience will become much more experiential. It'll be easier to use as a back and forth kind of method. So let's talk about the patient experience, what the expectations should be for their next visit. It might be in June, might be in August. I think for most of the providers, they're training right now. June's going to be a lot of learning new muscle memory with the system, and those patients just have a little extra grace when you come in for your first visit. They may be asking you some extra questions, some questions you may have already answered in the past, and that's okay. We're just teaching the new system. Now, we did archive all of the old stuff. We still have your whole health record, but we wanted to start with a new, clean source of truth because there were so many other systems running. It's very hard to know for the patient population, did we get everybody exactly right? So expect some new questions as you go in. Maybe an extra 15 minutes early. You may notice that when they make an appointment, they may ask you to come in early and fill out some information. Could be on the portal even, or some other areas where they may do some mailings to just make sure they have all of your stuff in there. They'll have some basic information. They'll know you're you. But moving forward, there's that one more time of teaching the system. The opportunity also, once it's in there, to instead of having to re-ask it, they'll just verify. When you go to the ED, I notice your medications are this. I know you had your last visit now. The questions in the future might change for a patient a little bit. It's not, tell me your medications. They'll say, hey, I want to confirm your medications. It's subtle, but I think it's important because there's an acceleration of care, and I think it's a better experience for both sides of the bedside interview to be able to have that data. I think the overall goal or the overall hope I have for the patients would be that they have maybe a few extra questions, but they recognize that the experience was better walking in the door and out the door.
It sounds like, given that all the clinics will be interconnected, all the wings of the hospital, it could possibly lead to better patient safety, better in terms of prescriptions and any other aspect that's skipping my mind right now. Is that an aspect of this?
It is, and I think we always are worried about patient safety and best patient practice. Like, how do we do the best we can for a patient every time? As I mentioned earlier, because of multiple systems and really just healthcare in general, there's always the providers and the secretaries and the nurses, and everyone's working harder than I think they should have to deliver safe care. In the future, with one system, you're alleviating some of those stresses. A simple example would be just medications. You saw your primary care doctor a few weeks ago. They made some changes, and you've been doing well, but hey, you had to go to the emergency department for some reason. it's 3 a.m. on a Saturday. How am I going to get that medication record? In the past, or if it was on paper, or whatever, it may have been difficult, or that provider also had to have sign-in privileges on another system to go look it up. Now, not only do I have the medications that provider prescribed for you, I have their notes, I have any labs that were drawn. It's just one system. And it's entertaining for working with some of the providers because we're so used to not having that experience that, I have to go look that up. No, it's on the same little screen that you're on with everything else. So I think that safety is inherent in having a single system. And I think that's true for kind of any industry, that the more complexity you can remove, the better. And this is really the culmination of a lot of work for a lot of years at Meditech to deliver a single product that's convenient for the doctor. I'd even mentioned that as we go through our training for the physicians, the system looks so similar that if I am a physician during the week in an ambulatory setting and I have to come in and do a shift in the inpatient setting, I'm very comfortable going between the two venues of care because it's really the same product. So the comfort level from the provider side hopefully will translate to a safer, calmer experience at the bedside for the patient.
We often talk about HIPAA, which is, of course, patient privacy. Essentially, it's respecting patient privacy, and only the providers, the medical professionals who need to know the information about the patient have access to that information. Mm-hmm. Does that become a component in OneCare? It
does, and there's patient information, which we always have to sign every time we say, yes, you can share my information. But it was also a Portability Act. It was supposed to be easily transported to everywhere else. And that never really happened for us. I think all of us have had that experience. Again, within the OneCare project, OneCare experience, using Meditech Expanse, the HIPAA becomes less of a direct issue. Obviously, if I'm not supposed to see your chart, I can't just go and jump into your chart. But when you come in and say, hey, I saw Dr. Jones in the outpatient setting, could you look up my record? Well, yeah, and in fact, because I'm in your record as the emergency physician, I can already see Dr. Jones' work.
OneCare, this electronic health record, launches June 1st, and we said shortly thereafter the patient portal, My Health Connection, will launch. As we've seen, the doctors have changed their expectations about what their electronic health records should do. Patients are also changing their expectations about what a portal should do for them. Mm-hmm. True? What are some of the advantages, or what are some of the capabilities of the portal?
Well, I think the portal will be largely the current experience the patients are having will stay the same in the short term. But imagine, I'll ask the question to the patient listening, what's the benefit? What would you want a portal to do? And this same question is being sent out nationally by Meditech to all of our customers. And what's the right way to do this? And it's provider driven. There's a lot of smart people back in Massachusetts working on this. But not just for the patient, but also for the provider. My cell phone's always in my pocket. What's the cell phone supposed to do? Can it integrate with my calendar? Yeah, I can look stuff up, but can it remind me that I'm supposed to be, don't have any breakfast, you're about to go to labs? I think there's a convenience factor that we're really pushing towards over the next, I can't give a time limit, 2 years, 2-3 years. But that's what we want to strive towards. The portal should be your communication with your provider, but also just a gentle reminder on the calendars or whatever it is. There's many ways where we can design success in the outpatient setting between encounters through the portal. In fact, when I talked about population health, the N of 1 or the N of 10,000, but every patient, real healthcare, population health happens between encounters. And I think the portal is part of that strategy where we can give subtle reminders, or you can ask a doctor a question. And it's not just logging into a website, it's in your pocket, it's your cell phone. So I think the patients will see a lot of that over the next couple of years roll out and have continued iterative progress in making it a convenience. I love the idea of having an extension of OneCare right into the pocket of the patient or a caregiver. I'll say that more generically. I think the portal is going to be a big win over the next couple of years as well.
That's Dr. William Gustin. He is a physician consultant helping us implement our new OneCare electronic health records here at KRMC. Dr. Gustin, thank you so much.
Oh, it was a pleasure. Thank you.
And that is the show. I'm T.G. Lafredo. Thank you for listening. We'll catch you next time.
Well, I'm a good editor. I'm not a wonderful radio host, but I'm a good editor, so I sound better than I really am.
Make me sound way smarter. That's what's the goal.